بسم الله الرحمن الرحيم. نبدأ اليوم بالشرح التوضيحي للمحاضرة الثامنة والأخيرة من محاضرات lipids. And the topics of this lecture is liver and lipid metabolism. The liver can take up the plasma-free fatty acids very actively for the synthesis of triglycerides and phospholipids, which may be stored in the liver or released into circulation. However, the liver and other tissues can utilize free fatty acids for energy purposes more efficiently. The liver has important role in cholesterol metabolism for either synthesis of cholesterol or its conversion to bile acids. Normal livers contain about 5% lipids. These lipids are found in kwpffur cells in the form of droplets. This figure or this percent may increase due to different factors. When the quantity of lipid in the liver reach about 25 to 30%, the case is called fatty liver. إذا normally الليفر contain 5% lipids. إذا زادت نسبة الليبيد بالليفر ووصلت إلى 25 إلى 30%، هالحالة هاي نسميها الفاتي ليفر. This may be due to many physiological or pathological factors. In this case, the fatty globules will replace the entire cytoplasm of the cells, and the liver cells become fibrotic, and when the condition persists, it will cause liver cirrhosis with impaired liver function. Fatty liver syndrome. There are many conditions which result in accumulation of fats or lipids in the liver, causing fatty livers. These conditions include the following. First, decreased fatty acid oxidation. Second, increased fatty acid synthesis. Third, impaired removal of fats from the liver. Fourth, excessive mobilization of fats from depots. If this case is prolonged, this condition may lead to first, enlargement of the liver. Second, fibrotic changes of the liver. Third, cirrhosis of the liver. And fourth, severely impaired liver functions. Now, the factors causing fatty liver can be divided as follows. First of all, we have nutritional factors, which can be subdivided into first, prolonged increase of free fatty acids in the plasma. This case may result from the following: excessive mobilization of fatty acid from the adipose tissue, or may be due to hydrolysis of a plasma lipoprotein or chylomicrons, resulting in accumulation of triglycerides, and hence fatty liver will. Prolonged feeding of a high fat diet, may be due to or during starvation, or in uncontrolled diabetes, and when developed to ketosis. Second, we have impairment in the biosynthesis of a plasma lipoprotein. In this case, the lipid transport is impaired, especially triglyceride, due to decreased lipoprotein, which is very low density lipoprotein, resulting in accumulation of fats, so fatty liver occurs. This type of fatty liver associated with lack of lipotropic factor, particularly choline and methionine. Methionine will be changed to choline, which is necessary for the synthesis or for the formation of Lecithin, which is types of phospholipids. So, choline is required for synthesis of phospholipids, which is Lecithin, and it considered as the most abundant phospholipids of cell membrane and represent a large proportion of body's store of choline. Choline is synthesized by trasmethylation of methionine, which is an amino acid, so diet low in protein may indirectly cause fatty livers, because low protein lead to low amino acid, low methionine, and so all these decrease the formation of phospholipids, and all these can lead to fatty liver. Third, we have deficiency of certain vitamins like vitamin E, B6, and vitamin B5. Also, deficiency of certain nutrients like essential fatty acids have been reported to produce fatty liver in experimental animal. The mechanism is not clear for essential fatty acids, but may be due to decreased synthesis of phospholipids. In addition, excessive ingestion of cholesterol and some other substance, example cysteine and serine, may result in fatty liver. Now we have the endocrine factors. Hormones which increase hepatic lipids storage include adrenocorticotropic hormones, which increase mineralocorticoids and glucocorticoids. We have adrenal cortical hormones, example cortisol, aldosterone, and androgens. Also, we have sex steroids and insulin. Other factors that also may lead to fatty liver, including the use of certain drugs or certain toxic substances. For example, of drugs, types of antibiotics like puromycin. For other certain or other toxic substance like alcohol, chloroform, carbon tetrachlorides, phosphorus, lead, and arsenic. The mechanism of action of these substances appear to be inhibition of hepatic protein synthesis. Some lifestyle changes that can help fatty liver disease include the following. First, we have eat a healthy diet, limiting salt and sugar, plus eating lots of fruit, vegetables, and whole grains. Second, get vaccinations for hepatitis A and B and for the flu and pneumococcal disease. Third, get regular exercise, which can help to lose weight and to reduce fat in the liver. Fourth, using dietary supplements such as vitamin or complementary or alternative medicine. In summary of this lecture, liver can utilize free fatty acids for energy purposes more efficiently when the quantity of the lipids in the liver reaches about 25 to 30%. The case is called fatty liver. Thank you very much.